Which of the following PGL types carries the highest risk of malignancy? Options are A PGL1, B PGL2, C PGL3, D PGL4. Answer of this question is PGL4. So these paraganglioma type 1 to 4 are related to different type of the succinate dehydrogenase types and as well as chromosome location. So there are different questions like most common head and neck paraganglioma occur in which type? So answer will be type 1. Paraganglioma type 1 produces multiple head and neck paragangliomas and this is the most common familial type and shows maternal imprinting. Type 1 is showing characteristic maternal imprinting. So head and neck paraganglioma most commonly occur because of PGL type 1. If I ask you exclusively head and neck paraganglioma occur in which type, then answer will be paraganglioma type 2 because paraganglioma type 2 occur almost exclusively in the head and neck but that are very extremely rare. So these all type of questions answer can be given in single table. So I'm making a brief discussion about this paraganglioma types. These all questions from the Scott Brown book of head and neck and this is the volume 1 from the basic science. Paragangliomas are tumors of paraganglionic tissue that derive from the migration of neural cell during fetal development that occur in both sporadic and familiar form. In the head and neck, these most commonly arise from the carotid body tumors, jugulotympanic region, glomus tympanicum, jugular bulb, glomus jugulare, and vagus nerve, that is glomus vagale. Another is the pheochromocytoma. If you compare the incidence of paraganglioma, that is about 1 in 10 lakh, while the pheochromocytoma incidence are 2 in 10 lakhs. Familial paraganglioma is inherited as autosomal dominant manner with maternal imprinting. Therefore, when individual inherited the paraganglioma gene from mother, regardless of whether she herself is affected or not, child is unaffected and become a silent carrier of the mutated gene. On the other hand, when a child inherits paraganglioma gene from the father, offspring will have paraganglioma regardless of affected status of the father. So, this is the maternal imprinting of the gene of the familial paraganglioma. Initial incidence of sporadic versus familial paraganglioma are sporadic was 90% while the familial was 10%. But recent development and discovery of succinate dehydrogenase complex linked to familial pheochromocytoma or paraganglioma syndrome lead to at least there is 30% of familial type of paraganglioma. So this link between the succinate dehydrogenase complex with the pheochromocytoma or paraganglioma syndrome lead to the discovery of this different type of the succinate dehydrogenase complex. So there are four different type of paraganglioma that recognized as a paraganglioma type 1 to 4. Now, if you compare the gene mutated succinate dehydrogenase gene related to this from 1 to 4, you can remember by DAC-B. Like paraganglioma 1 lead by D, paraganglioma 2 lead by the A, paraganglioma 3 lead by mutation C, and paraganglioma 4 by the V. If you see chromosome location type 1 11q21, type 2 11q13, type 3 1q21, type 4 1p36. These are the gene location. If you compare keynotes about these, type 1 lead to most common familial type or paternal inheritance pattern. Type 2 very rare and primarily leading to head and neck paraganglioma. Type 3 usually benign and mostly related to head and neck paraganglioma. And type 4 is highly malignant, and this type 4 is leading to most malignant form of the paraganglioma. So most striking clinical feature of type 4 is the highest percentage of malignant pheochromocytomas that in the head and neck region.